In the last two lectures, we were discussing the stress, what is stress, and the diagnosis of stress. Today, we will discuss the whole as it is not considered as an overload. We have discussed it as it has positive effects, and what is the difference between anxiety and stress. Two conditions: stress is not a mental disorder, and anxiety is just a psychiatric disorder. But stress is the normal physical response that you have when you are faced with a challenge. This challenge might be a paper deadline coming up, an important meeting, or a job interview. Stress from examination, stress from meeting, stress from interview, job interview. Then feelings of stress often dissipate after the stressful experience or challenge has ended. Anxiety, on the other hand, is a different condition altogether and is more similar to constant fear. It often occurs for non identifiable reason. For some people, worry and anxiety can become overwhelming and disrupt their quality of life. Excessive and lasting bouts of worry may reflect an anxiety disorder and will require different treatments. Then we will discuss the common effects of stress. What are the common effects of stress? Stress is the normal reaction of our body. Here, the stress affects every aspect of our lives. We have discussed previously, it has the mental effects, it has also the physical effects, emotional effects. You may experience mental, behavioral, physical, and emotional symptoms. While these symptoms are common during stressful times, people with anxiety disorders may experience them in absence of a stressful experience. What effects you have on your body? On your body, you may have the headache. The physical effects are headache, muscle tension or pain, chest pain, fatigue, change in sex drive, stomach upset, sleep problems, frequent illness. What you have the emotional effects on your body, you will feel anxiety, restlessness, tiredness, lack of motivation or focus, irritability or anger, sadness. Your mood will be so depressed or sad, forgetfulness, feeling overwhelmed, insecurity. And the effects on your behavior, we have already discussed the emotional, mental, and physical effects on your body, and also the positive effects on your behavior, on your mind, and the positive results of the stress. Positive effects of stress, positive results of stress. Now, on your behavior, what are the effects on your behavior? Over or under eating, like causing the stomach very upset, and angry outbursts, drug, alcohol use, social withdrawal, sleeping too much or too little, relationship conflicts, crying spells, avoidance, and procrastination. All these effects are related to the stress. Stress is not a mental health condition, but it may cause the mental problem in your body, in your mind. Feeling stress will lead to anxiety, depression, and sadness and anger behavior. Stress busters. What are these stress busters? Stress management is an important skill. Stress management may also lead to the brain problems, neurological problems, and also the mental health problems. Okay, it is an important skill, but you have to manage stress. Either it is increasing or decreasing, you have to manage it properly, and it is worth taking the time to figure out what works best for you. Taking care of your mind and body can go a long way towards managing your stress level and help restore yourself to balance. Here are some suggestions: get enough sleep, eat a well balanced diet, like you have to eat your diet properly, and healthy diet, and eating proper food at proper timings, and well balanced proper diet. Sugar and processed foods can make stress worse. You don't have to take sugar or processed foods, as it will cause increased stress and it will not manage the stress properly. You have to eat a well balanced diet. Get enough sleep, don't too little and not too long. Okay, and either you will sleep disturbance may cause the tiredness and headaches. Exercise regularly. We discussed it previously. Exercise regularly will cause your mind to relaxation, and also the mood be happy. Find movement you enjoy that allows you to release tension. Learn deep breathing or relaxation techniques like these. 1 minute stretches. Pay attention to negative self-talk. Pay attention to negative self-talk and don't focus on what you cannot do. Just focus on what you can do. Meditations may be taken for the high blood pressure, the headaches. Mindful based meditations should be taken for the headache, tiredness, sleeping, and panic attacks. Find and reserve quiet study spaces during COVID-19 pandemic, practicing no to situations that you are not comfortable. Say no. Call a friend or someone you trust, limit your caffeine intake, avoid using alcohol or other drugs, manage your time and energy, laugh, take time for relaxation, fun, and hobbies. Read for pleasure.